Do you keep forgetting to ask your OB provider all your questions at your appointments? What about those signs and symptoms they told you to look out for in your third trimester? Do you remember them? I've got you covered. I'm about to answer a lot of frequently asked questions during pregnancy, and I'm gonna remind you about some signs and symptoms of concern during the third trimester. I'm Hillary, the mama behind Baby Settler. I'm also a registered nurse who spent the majority of my nursing career working as a bedside labor and delivery nurse in the Charleston, South Carolina area. If you just found my channel, I'm so glad you're here. Will you take a second to hit that subscribe button at the bottom right corner of this video, and be sure to like this video by giving me a thumbs up. If you're currently pregnant, I've got a free Prepare for Baby webinar I'd like you to join. You can find that in the details box below. Working at the bedside as a labor and delivery nurse is one of the most rewarding jobs out there. Seriously, getting to be part of such an intimate time in a parent's life has been one of the greatest joys of my life. After working with expecting parents, I found these are the most common questions and concerns. Here are some frequent questions I hear during pregnancy. Can I drink a glass of wine once a week during pregnancy? Honestly, it's really best to avoid alcohol while trying to conceive. Even small amounts can affect the development of a baby. A safe level of alcohol used during pregnancy has not been determined. If you're worried you have a problem with alcohol consumption, you should discuss this with your OB provider for help in coming up with a plan to help support you. Can I eat deli meats and seafood during pregnancy? If this isn't your first pregnancy, maybe you'll fast forward right past this clip. I know I personally got more lax with each pregnancy, but I want to share the facts with you. It's good practice to wash all your fruits and vegetables prior to eating to avoid potential infection from foodborne diseases. Bacteria such as Salmonella, Listeria, and Toxoplasmosis can live on unwashed fruits and vegetables and uncooked, unpasteurized foods. You should really rinse all your vegetables and fruits thoroughly before eating. Maybe even consider buying frozen fruits and vegetables over fresh if you find that you can't get in the habit of washing your produce. Bacteria can also live on meats and cold cuts, and recommendations are to thoroughly cook before eating. You really should avoid soft cheeses such as feta, brie, and queso, and any unpasteurized dairy products. They can also harbor harmful bacteria. Seafood is a good source of protein, not to mention delicious. And a lot of people may avoid meat in their diet but will eat seafood. During pregnancy, you want to avoid any uncooked shellfish or fish. It's also important to limit fish that are high in mercury levels. Can I lie on my back during exercise? That's a great question. Many yoga, Pilates, and stretching exercises will have you lie flat on your back or on your abdomen. And as your belly grows during pregnancy, you'll find it uncomfortable to be in either of these positions. You can try tucking a pillow under your knees for support to help your lower back, or lie on your side for comfort. It's really best to avoid lying on your back as you approach your due date. It can decrease the blood circulation for you and your baby. A lot of women will report feeling short of breath or dizzy when they're lying on their back. When you're beginning to see your baby bump, you really shouldn't lie on your belly. Another question I hear is, I have a thyroid condition and take medication every day. Is this okay during pregnancy? Many women have chronic health problems requiring daily or regular prescription medication use. You'll want to make sure you discuss all your medications with your healthcare provider when considering pregnancy. Some medications could potentially harm your baby or cause other complications during pregnancy. But you don't want to stop any prescribed medications without discussing those with your healthcare provider first. The good news is this: there are usually safe alternatives for most medications and conditions that require medication during pregnancy. Is it safe to take ibuprofen or Motrin? Once you find out you're pregnant, you'll want to avoid non-steroidal anti-inflammatory drugs. These include ibuprofen, naproxen, and aspirin products. These drugs may cause bleeding complications as well as have potential adverse effects to your developing baby. Tylenol or acetaminophen is usually safe for most people during pregnancy. Sometimes aspirin is prescribed in higher risk pregnancies, but you'll want to make sure your provider prescribes this for you before you start taking aspirin. Another question I get: I have allergies. Can I take Sudafed? If you have a cold or allergy symptoms, it's safe for most women to use antihistamines during pregnancy. but it's best to avoid decongestants because they can increase your heart rate. Make sure to check with your OB provider if you have any problems requiring over-the-counter medications. You want to confirm that it's safe for your growing baby. Here's another one for you. I have a cat. Can I continue to change the cat litter while pregnant? Honestly, it's really best to have another person in your house be responsible for cleaning the cat litter while you're pregnant. Cats may excrete toxoplasmosis, which can cause congenital abnormalities in the unborn baby. I work at a daycare. Should I be worried about catching something from other children? Good hygiene and hand washing is important during pregnancy. Young children can pass on infections that can be potentially serious during pregnancy. Parvovirus, varicella, and cytomegalovirus are a few of the most commonly seen viruses in daycare. Most OB providers recommend that all women of childbearing age receive the varicella or chickenpox vaccine if you're not immune to the disease. If you're worried about exposure to one of these infections, reach out to your OB provider to discuss options for laboratory testing and treatment. Another tip is wearing gloves during direct contact with bodily secretions, wearing masks to protect yourself from respiratory droplets, and frequent hand washing are good ways to help prevent transmission of illness if you work with small children. Also, current recommendations are that all healthy pregnant women receive the influenza or flu vaccine each year to prevent complications from the flu. You'll want to talk to your OB provider about risks and benefits of the flu shot. Sometimes women don't feel excitement over their pregnancy, and they'll ask the question, is something wrong with me? It's not uncommon to feel overwhelmed over a pregnancy, even if it was intentional. Many changes are happening physically and emotionally as your body adapts to pregnancy. Pregnancy hormones can contribute to sleep changes and fatigue, and that can make it difficult to be excited about anything if you're feeling exhausted. If you have any nausea or decreased appetite, you may be frustrated by your inability to eat normally. Your clothes might be fitting tighter. You might have financial worries or fears of how this might affect your relationship with your significant other. And all of these things can contribute to a feeling of fear and apathy. On pregnancy number 3, when my husband and I found out we were having a girl, I was kind of disappointed. I'm just being real with you. You may think, what is wrong with her? But I was a boy mom. I knew how to be a boy mom. We were having a girl. It was an adjustment. I was anxious. I was worried about what it would be like having a girl, and I was also a seasoned mama. So if that's you, it's okay. It's more than okay. Share your feelings with your partner. And I want you to know that depression and anxiety can occur anytime in life when changes occur. Even positive events can cause stress in our life. If you have difficulty performing your normal activities, are sad and crying, have difficulty falling asleep at night due to ruminating or anxious thoughts, or these feelings are creating tension in your relationships, follow up with your provider. Counseling and medication are 2 options you can consider, and good nutrition, vitamin D, and restorative sleep go a long way. Here's another scenario. The nurse called and told me that I was anemic and my vitamin D level was low. How can I treat this? Your actual hemoglobin and hematocrit numbers will determine what kind of treatment you need. Oral iron might be prescribed, and a recommendation to consume iron-rich foods. If you're very anemic, you might be referred to a hematologist for evaluation. Iron infusions are often given during pregnancy to boost the iron stores. Your counts will be checked throughout pregnancy. Let's talk about vitamin D. I love vitamin D, the good old sunshine and the supplement. Vitamin D3 is a necessary vitamin for many body functions. We often don't ingest foods rich in vitamin D3 or receive enough through sun exposure. Vitamin D deficiency has been linked to preterm labor and postpartum depression. I'm not saying it causes these things, I'm just saying there's a link. If you're planning to breastfeed and your baby's gonna have exclusive breast milk, you really need to supplement with vitamin D. Babies who are receiving breast milk exclusively need vitamin D supplementation. Moms can take 6,400 units daily of vitamin D, or they can supplement their baby with oral vitamin D drops. It's important to keep your vitamin D dosage right at the 6,400 unit mark unless your provider tells you otherwise. You don't want to take 10,000 units if you don't need to. You can take a 5,000 unit, 1,000 unit, and most prenatal vitamins have 400 to 500 units in them. That's how you get the 6,400 units daily. Here's another scenario for you.
I had some vaginal bleeding last night and I'm Rh negative blood type. Should I call my provider today or wait until my next visit? Anytime there's vaginal bleeding during pregnancy, you should call your OB provider immediately. If you're Rh negative, you'll get a RhoGAM injection after any bleeding episode during pregnancy. Your provider might do an ultrasound and pelvic exam to figure out the cause of bleeding. Sometimes intercourse can cause bleeding. I want to mention this because I've seen so many worried parents show up at the hospital due to vaginal bleeding and they've recently had intercourse. It does happen sometimes, but you should still get things checked out by your OB provider. I have just been diagnosed with gestational hypertension. Does this mean I'll develop preeclampsia? When you get a diagnosis of gestational hypertension, it means that you have elevated blood pressure readings after 20 weeks of pregnancy. Gestational hypertension could potentially lead to preeclampsia during pregnancy and chronic hypertension after pregnancy. Untreated gestational hypertension can cause fetal growth restriction, preterm delivery, placental abruption, preeclampsia, as well as a higher risk of cesarean delivery. It's really important to follow your OB provider's recommendations for your plan to keep your blood pressure under good control. Your provider will give you specific parameters to keep your blood pressure within, and you might need to take medication. It's really helpful to have a home blood pressure monitor to keep a daily check on your numbers. Also, knowing warning signs to look out for are important. Gestational hypertension can lead to preeclampsia. So what is preeclampsia and how do we treat it? If your OB provider suspects you may have preeclampsia, you'll have lab work ordered. You might also have an ultrasound to check on your baby and an NST, which is a non-stress test. If your blood pressure is high and your labs are abnormal, you might be admitted to the hospital labor and delivery unit for observation and possible delivery. Medications can be given in the hospital to manage preeclampsia, and your provider will want to closely observe and monitor your baby's well-being. Preeclampsia is a complication of pregnancy that usually presents with elevated blood pressure readings and protein in your urine. Preeclampsia can lead to life-threatening complications for mom and baby if left untreated. Symptoms might be epigastric pain or heartburn, visual changes like seeing spots, shortness of breath, or a headache. It's really important to report any new problems to your OB provider immediately, especially if you have elevated blood pressure. Here's another question. My provider asked me to come into the office because I reported decreased fetal movement. What can I expect? If you're experiencing decreased fetal movement, your OB provider will bring you into the office or hospital to monitor your baby on the NST. If your baby's fetal monitor strip shows good short and long-term variability, they will most likely send you home with instructions to do fetal kick counts. If your baby's fetal monitor strip shows a decrease in variability, a biophysical profile, or BPP, can be done to check for fetal movement, amniotic fluid level, muscle tone, and breathing. This will help your OB provider determine the next best steps to take. I want you to hear this. If you're ever worried about the well-being of your baby, do not hesitate to call your OB provider, even if you just have a gut feeling something isn't right. There are labor nurses at the hospital 24/7 who can easily put you on the fetal monitor to check on the well-being of your baby. Be assertive and advocate for you and your baby's care.
I hope this video was helpful to you. Hit that thumbs up button if it was. If you're looking for more information about birth, you might be interested in some of my free downloads. I've got them linked in the details below. I also have online courses on birth, breastfeeding, and babies and sleep, and you can find those linked below as well. If you haven't already, don't forget to click that subscribe button. And if you have any questions or comments about the video, drop them in the comments box below. I see all the comments and respond to all the questions. And don't forget, you've got this.